Good night. And tonight I'm here with you once again at 1524 LaVista Drive, Decatur, Georgia, United States of America. I'm on the second floor and I'm on the anatomy of the breast. Know that in many of my lectures I have this title here, CME. Most of the time it was with the matrices, with the amazing 5x12 matrix, matrical education, CME, and sometimes it's CME with respect to electrical engineering, and sometimes the CME is with respect to mechanical engineering. Tonight, the CME is representing ME, medical education. So the CME has been used in diverse and versatile way to represent many fields of education: mechanical engineering, metrical education, mathematical engineering, and now medical engineering, as well as medical education. All right, so I'm on the anatomy of the breast. Here's truly Dolphy Gilpin. And on the side here, we have, if we start, we have, if we should take the whole human body and we split it in half, we have a left side and a right side, and that will be probably a sagittal view, representing the body in two halves, left and right. And here we have now the breast, the left breast, the clavicle, which is the upper boundary of the breast, and that will be right up here, the clavicle. Then we have now the nipple of the breast would be right here, and the nipple is the outlet from where the milk comes from during breastfeeding. And you have the right breast, where sometimes the left, in my view, would be right and the right the left. So sometimes you will see this as being the left, representing the left in certain views. Anyhow, okay, I'm not using the left as the left and the right from my view right here, and not from the diagram view. So here's it now. This side of the breast here, representing the right breast, as the duct, the axillary lymph nodes, which filter the lymph fluids from the breast and help your body to fight infection. And here we have now the fatty tissues, right here, and spaces around the duct and the lobules. And the lobules are the mammary glands. And here we have now the lobules itself right here, or the mammary glands, which produce milk during pregnancy and breastfeeding. And here we have now the duct carrying the milk from the lobules during breastfeeding. Here we have the fibrous tissue, which support the breast, making them feel very firm. That's the fibrous tissue. And then we have the sternum, or the breastbone, which can be felt beneath the skin. This is the sternum here, or the breastbone. Yeah. The chest muscles up here, which help to move your arms. The ribs, which can be felt beneath the arm. And we have gone through the fatty tissues, filling the space around the duct and the lobules. So this is a diagram of the sagittal view of a healthy breast, left and right. And this is really the female, as you know. We have to sort of clarify the view that men can also have breast cancer, as we'll come to see, but most of the time breast cancer is associated with the female. Anyhow, as we continue, we have here, down here, a side view, where we have now the fat here, the breast, the nipple, right here, and the aorta, which is that circle around the nipple, that sort of a dark circle around the nipple, and the lobules, which is the mammary gland, and it is also shown from the frontal view perspective, the nipple here, and the ducts here, and the right around here would be the aorta, A-R-E-O-L-A, and this is the frontal view and the side view. All right, if we should sort of stay here now, what we'll have is the anatomy of the breast, female, the chest wall here, the pectoral muscles there, the Cooper's ligament represented here, the major duct, the lactiferous duct, which is one of the major lactiferous, lactate, come from the word lactate, milk, areola, that round space around the nipple, and this is the nipple itself, and the lobules, which are the mammary gland, said here, the lobules, milk glands, and the fatty tissue will be here. And if we again should look over here, we'll have now tumor, this one representing an abnormal breast, and right here we would have like a tumor, and the tumor tissue removal here now by mastectomy. Here we would have a case now of an inflamed breast, and this was representing now a breast with inflammatory breast cancer. It's sort of in a sort of pinkish red color here, representing inflammatory, inflamed, and this one here is white, representing that it's normal. So just one of the breasts here is this inflammatory breast cancer. And here we have now a diagram of another abnormal breast with cancer. This is a cancer here. These are the lymph nodes, muscles here, the nipple here, the aorta here, and actually this is just, take out the word inflammatory, it would be just a breast cancer here. This one is representing a breast cancer. Although we have the word inflammatory here, it's just a breast cancer. As we'll come to know, there are many types of cancer. There are angiosarcoma. This is just a general cancer, but it could have been an angiosarcoma. You have another cancer, which is the invasive ductal carcinoma. They have another type of breast cancer, which is the invasive lobular carcinoma, which is coming from the glandular tissues. Then you have the page-dead sort of breast cancer. Then you have the lobular cancer in situ, and the ductal cancer in situ, and the recurrent cancers of the breast, and also now you have a cancer, the inflammatory breast cancer, which is this one represented here. But we are just going through the anatomy of the breast here, and we are shown normal breast, and we also shown some breast which is abnormal with tumors, cancers, and inflammatory cancer in this one. So that's the anatomy of the breast, and then we'll come on now to describing the LaVista's cancer, which we described verbally, but we'll go in more in depth with these cancers and their treatments, their diagnosis, via mammograms and other forms of ultrasounds and elastograph and other form of diagnostic instrumentation technology techniques that can help to diagnose the cancer very in precision. We also know that some of these techniques are invasive and some are non-invasive. Like the mammogram is, there's sometimes a little pain in doing this process, as when you squeeze the breast in between the mammary sort of plates, then sometimes some females sort of feel a pain in the breast or a discomfort, but this is negated, or this is now sort of eliminated in certain other type, like in the ultrasound type, to diagnose cancer. And there you'll come to find there are some also thermographic sort of type. It's a more modern type of diagnostic way to help to diagnose the breast cancer by non-invasive techniques. So once again, this is the anatomy of the female breast, and it's showing sort of a sagittal view, left and right breast, with various sort of organs surrounding the breast, which surrounding the breast would be like the clavicle, the neck, the border between the clavicle and the upper boundary of the breast. We have the breast itself with the nipple and the areola, and the fibrous tissue supporting the breast, making them feel firm. Fibrous tissue over here, and the auxiliary lymph nodes, which filter lymph fluid from the breast and help your body to fight infection. Once again, the chest muscles, which help to move your arms, the ribs, which can be felt beneath the arm, the lobules or the mammary gland, which produce milk during pregnancy and breastfeeding, and the duct carrying the milk, and the lobules during breastfeeding. So that's just a brief and sort of a simple view of the anatomy of the breast. And we have also used an abnormal breast with tumors and inflammatory cancer, as well as cancer, to help highlight some of the components of the breast. Here we have also the lymph nodes. This one is highlighted lymph nodes in this sort of a breast cancer here. And we know that lymph nodes sometimes in the metastatic carcinoma of the breast, then the cancer spread through via the lymph nodes, and spread to other part of the body. So we'll start to take a break from the anatomy of the breast, and we'll come back with what we want to come back with treatment, causes of breast cancer, treatment, and diagnostic techniques to confirm or to diagnose the symptoms of breast cancer. So once again, yours truly, Dolphy Alexander Gilpin, just briefly signing out from this brief lecture on the anatomy of the breast. And this is in our CME, Continual Medical Education. And once again, we have differentiated this sometimes to represent continual metrical education, continual mathematical engineering, mechanical engineering, as well now as it now represents medical education continuity.